Hello, everyone, and welcome to another episode of Tech Tuesday. My name is Dr. Haifa Maamar. I am the Education Director of Emerging Technologies here at Full Sail University. And we are streaming live from the Fortress here at Full Sail and live on YouTube, LinkedIn, and Facebook. Today's episode is about innovating healthcare industry through emerging technologies. We know that with the advances and development of new emerging technologies, the healthcare organizations have been choosing, accelerating, and evolving their innovation effort to improve the healthcare quality and enhance patient safety. And to talk about this subject, healthcare and emerging technologies, I have the amazing guests with me today, some industry experts and folks from Full Sail University and some from AdventHealth University. So on my right side, I have Rob Cato, Dr. Sean Stafford, and on my left side, I have Todd, Larson, and Brandon Baker. Welcome, guys. So how about we start by please introduce yourself. Tell us about your current role, either here at Full Sail University or at AdventHealth University. Let's start with you, Rob.
Hi, my name is Rob Cato. I'm the program director for the Simulation and Visualization program. I'm also the program director for the Game Design graduate degree.
I'm Sean Stafford. I'm director of research at Full Sail University. I run the IRB as well, and I'm also director of the UX lab.
I'm Todd Larson. I'm the Director of Simulation and Innovative Technologies at AdventHealth University. We have campuses here in Orlando and in Denver, and we're strictly a healthcare university.
My name is Brandon Baker. I'm the Senior Program Manager for Innovative Technologies at AdventHealth University.
Thank you all, and I'm so happy to have you with us today. So we're talking about healthcare and how emerging tech plays an important role in healthcare, because actually back last month, on October 13th, we had the ribbon-cutting ceremony for the new Full Sail University Healthcare Technology Lab powered by AdventHealth University. And I think actually we've been working together for over 3 years now. We've been producing, implementing, brainstorming different ideas, different projects on emerging tech, how to use emerging tech in healthcare. First, let's start by seeing the video about the AdventHealth lab, and then I want to know more about how this partnership came about. So let's play the video. Wow, lots of cool technology that I see there in our AdventHealth University lab, the healthcare lab. Again, we had the ribbon cutting ceremony back in October 13th actually last month, and it was kind of that another step into strengthening the relationship that exists between AdventHealth University and Full Sail University. But let's talk about the beginnings. How did we start this? Brandon, you want to start?
Sure. Yeah, I can field that question. So legend has it, two professors, one from our university and one from Full Sail, met Dr. Chris Lorenz, who's a nursing professor at AHU, and John Fairchild at Full Sail met in a church men's group. I was working with Dr. Lorenz, and as part of his doctorate, was looking at medication management, and we had modeled a basic medication management cabinet, and we're trying to do some things in the virtual environment, but we were just hitting a wall. And so the two of them were talking about what they do, and John Fairchild says to Dr. Lorenz, "Oh, I know a lot of people who can help you get past that barrier you're hitting at Full Sail." So next thing we knew, we were invited to Dan Mapes' lab here on campus, which is the AR/VR lab, which is part of the simulation and visualization. And next thing we knew, we had students working on the project, and we completed our first proof of concept project based on that relationship.
Amazing. Sean, I know that you are an instrumental person in this relationship. Tell me what made this relationship works.
Not all relationships work, and you got to have a connection with the people you're working with. And when we started with AHU, it just seemed like we knew each other for a long time. We were friends, and I think that was really important. That there weren't a lot of expectations at the time to produce anything, but we knew we were going to, and we knew we would follow through on what we were planning. So, sometimes when two organizations get together, it's not a good fit. In this case, it was a really good fit, and everybody seemed to just get along, and ideas started coming out, and next thing you know, we're 1, 2, 3 projects, sometimes 4 projects in before we even started talking about formalizing the agreement, and that's a great way to start any business relationship.
Yeah, I agree. Rob, you oversee the SimVis program, and most of these projects, I think all these projects actually were part of the SimVis program. I know that lots of different industries, organizations, institutions are always interested in being part of the Fab Lab, the AR/VR lab, and you receive different projects on a daily basis. But then what made you choose this project, and you and Dan Mapes collaborate together to make this happen?
So the SimVis program is made up of 4 focus areas: programming, fabrication, visualization, and production. And Dan runs the visualization side of the program. And right from the get-go, we had this idea, because Dan and I go back 30 years to the early days of virtual reality in the early 90s. And his idea was to take the visualization courses and treat it like a small business, bring outside projects in, along with a subject matter expert. And so when AHU came along, we'd already been working with several companies previous to that. And so it was a perfect fit for that particular class and for that focus area, which is visualization. And so Dan takes his students, and for us in simulation and visualization, which I'm going to call SimVis from now on, SimVis projects are not typical 1-month projects like most other programs are. All our projects run the gamut of how long the project's going to take. So a student might start a project, a student might come in the middle of a project, a student might finish a project. And what that enables us to do is to create prototypes and proof of concepts that are much more complicated and capable of taking a situation from 1 month to 2 months to maybe even 6 months. And with the fact that he brings a subject matter expert in that actually works with the student, and then the fact that we are also integrated with the game design graduate degree and the production track, we throw a producer in on those projects, and that whole circle has enabled us to have the success that, and that procedure has made us successful in that arena. And since we've been working with AHU, we've got, 5 or 6 different projects that we've completed.
Amazing. So Todd, I don't know how AHU or pre this relationship, let's say previous to this relationship, I don't know if you guys had any kind of VR simulation trainings or any of these sorts of trainings, remote trainings, let's say, for your students, but having these two professors starting talking to each other and then slowly getting the two institutions to collaborate together, you must have seen benefits in these types of projects.
Oh, absolutely. We all went through the pandemic, and finding a way to deliver that training remotely to our student body, that really wasn't on campus every day, using and leveraging this technology certainly helped us get there. And so now we're seeing more and more use of it as faculty become more interested in, hey, how can we do this differently?
Amazing. So we saw the video of the lab, and this lab will be providing endless opportunities for both Full Sail students and AHU students, AdventHealth University students, to innovate, to collaborate, to conduct a progress review, to expand those learning opportunities, for you guys to practice skills remotely, for us on the Full Sail side to program and implement those projects and have our students also be part of those projects. So let's talk about the technology that exists in those labs. There we saw different through the videos, and we'll be displaying those pictures behind me, where we are seeing different hardware. And there is, of course, software associated with that. So, Rob, if you can tell me about the hardware and software that have been used in these projects.
Well, in the AHU new lab, the elephant in the room is the Stratasys F770. We have 5 different 3D printers on campus, and projects in the past. Our largest volume that we've ever had the capability of printing in has been 12 by 12 by 14. This particular printer now allows us to do prints in a volume of 24 by 24 by 39 and a half. What that means is that if we need to do a prosthetic for somebody, we can do a whole leg. Or if we need to do a mold for someone in the health industry, we can do a whole torso. And it really revolutionizes the way we do things. But that room is going to fluctuate with technology as the projects come and go. And so it is a flexible space. But right next door, we've got the Fab Lab that has 3 more 3D printers. One of them is also a resin printer, which is a completely different technology. We've got a CNC machine that enables us to make our own circuit boards. We've got a laser cutter. We've got traditional manufacturing in there. We've got an electronics bench. So we're really capable of doing a lot of different things in the lab, especially with the occupational specialist students that will be joining us.
Mm-hmm. And then what about the software then? Now, and then you didn't talk about you talked about the simulation. What about the visualization part of it?
So on the visualization side of things, we have all the current consumer and prosumer technology. We also have Z-depth cameras that allow us to do some really cool visualization. And one of the projects in here actually uses that. And then we've got technology from Quest. We've got technology from HP. We've got technology from Magic Leap. We've got technology from Microsoft. And then on top of all of that, we use Unity as our primary engine in the visualization side of things, and then in the production side of things, we switch to Unreal. And then, of course, there's the C++ and C# software development that we use Visual Studio as our IDE for that.
Thank you. So now on the AHU side then, now that Full Sail students develop these prototypes or proof of concepts, the idea is that you guys take those to your campus and have your students practice that. I guess, is it on campus? Is it remote? Do you just push those remote and then send them VR headsets? How does it work on the AHU side?
It's a little bit of both. So we have some small labs within our campus that students can come and do VR with the equipment, or if need be, they can check out the equipment and take it home, or we send it to them, depending on where they are in the program.
Right. So let's go back to the first project that was developed. Brandon, I know from talking to you on the day actually of the ribbon cutting, we were talking about the first project, how it started, and then when the pandemic hit, how it evolved. So can you tell me a bit more about that?
Yeah, so the first project that we did was right before COVID happened. So we wanted to tee up the next project right away, but our campus had gone completely remote. Full Sail had pretty much gone completely remote as well. So we were trying to figure out a way to maximize where we were at with VR technology. A lot of my background in VR tech is in 360 video. So I know that you can rapidly create scenarios using video, but we wanted to do a scaling project where we could get multiple people within a scenario together. So that's kind of where we landed in the lab for the second project. And the students found an innovative way to get, using network plugins for Unity and things like that, of getting people in via avatar to different video scenarios that we had created with some nursing leader help. And we actually got to the point where we could have an instructor, and we had 5 students all at different places either in their home, not necessarily in Florida. I'm not real sure where they all ended up being remote, but we were able to bring them back together in a virtual environment and learn together.
That's amazing.
So we kind of completed that cycle all the way to proof of concept.
So it's a networked VR training system, up to 6 people, I guess, with the 5 5 students for an instructor.
And they learned clinical skills. There was a mannequin in a bed, and then they had to watch, what the mannequin did, and then assess the patient and answer questions. And it was a very robust kind of way of learning, that we put together in a couple of months.
Amazing. So from the Full Sail side, I know that during the pandemic as well, there were so many different projects that have been implemented to help the healthcare workers during that time specifically. There were difficult times during that time. And I remember back then, it was every time talking to Rob or talking to Dan Mapes or talking to Pat, I'm hearing about new projects that have been developed to help healthcare workers. So Sean or Rob, if you can tell me some of those projects.
Yeah, I'll start with a project we worked on with Pat Steris and one of the physicians at AHU. And early on in the pandemic, when the cases were skyrocketing and no vaccines and youth sports had shut down locally, and then when it did start back up, you had to have kids separated by 5 or 6 feet. There could be no contact, and it's kind of impossible to do for things like soccer and football, and you can't train in a mask. It's just you couldn't get enough air. Oxygen's very stuffy. I mean, you need something high performance, and there were some powered masks out there, but they weren't suited for athletic activities.
Yeah.
So we got together with Pat and a physician at AHU, and
were there any students involved during that time?
I don't know at the time because we just had transitioned to online. Yes, there were students involved from the user experience lab, actually.
Perfect, okay.
So we kind of had different pieces we had to accomplish here, which was, how do you wear a mask playing sports and that doesn't injure you because balls are impacting your face at various times? What type of fabrics do you use? How do you secure it? How do you power it? Is it going to give you enough air? Is it going to last long enough for a sport event? So I think between the two organizations, we were able to, build a team, and we actually ended up building a prototype.
That's amazing.
And shortly after that, sports resumed as well.
That's great.
Well, we are the Sim Lab, and we do have access to 3D printers. So we contacted a group that was distributing COVID equipment to healthcare facilities, and we started printing the little bands on the back for your masks, and then we also started printing the bands to hold face masks, and we just had the printers going 24/7.
And I remember you were donating all those.
And we donated all of those to this group, and then they distribute them out to the different healthcare groups that needed them.
And then during that same time, also Pat worked on the ventilator, right? The 3D.
Yeah, that was the same time when the ventilator shortage had started, and Pat Starace, who is the course director for a digital fabrication course, on his own started developing a ventilator that could be made inexpensively, and he created that tech and provided it, made it available.
That's amazing. So the initial VR training that was developed here kind of inspired AdventHealth University to kind of take advantage of the technology and create new opportunities to engage with the remote learners during the pandemic. Todd, if you can tell me a bit about some of the advantages of using VR training systems or kind of remote learning versus the traditional world. So remote learning, not the online. I'm talking about the virtual reality training systems versus the traditional approach of training your students.
Well, with traditional training, you usually have to bring people to your facility or be in some kind of formal classroom or have the equipment readily available to do it. In the pandemic's case, we couldn't do that. So we got to find a different way to learn and get it out there. So VR provides a great platform for that. So we can deliver something that's consistently done. So it's the same product all the time. It's not going to be different because some instructor gives it a different slant. I'm going to deliver an engaging experience, and I can scale it to a large number of people. And it doesn't matter if they're here, across the country, on the moon, for that matter. We can still do it.
Great. And then, Brandon, having your instructors and students going through this virtual reality training system, network virtual reality training system, and training or practicing their skills through that system, have you heard any feedback, whether it's good or bad, of how did that either help them, not help them? And did we meet the goal or we did not? Did the VR really help train those students or it did not?
Yeah, I think one of the main wins that we got from shifting to this kind of learning for some things is that a lot of the students may have some fear of the clinical setting, that it's pretty high stakes. You got to be on your toes. And so being able to practice that in a safe environment that VR gives you over and over again until you feel confident enough to head into that patient room was a key win for us in using this technology.
That's amazing. And then I know that the cost is another factor that was taken into account as we're developing the VR training systems as well. I know that the healthcare technology market is expected to be $391 billion by 2024. And so many healthcare organizations who have not been considering emerging technologies in the past, now they're changing their focus to see how they can use technology. But then looking at that as well, we know that it's not easy to have healthcare students or nursing students or physician assistants practice their skills on sometimes either on some very for example, the Da Vinci surgical robot. So it's a very expensive tool, and as you said, access is a point, but also the availability of that tool is another thing. So can you tell me more about that? How did this VR help in this?
Well, having access to expensive equipment that may not be available for training, or we may not be able to get it because of the outrageous, capital cost for us. To be able to model that in VR, be able to interact with that piece of equipment in VR and measure their performance is extremely valuable. And as I spoke to earlier, that can be scaled across a large number of learners very cost effectively.
Perfect. So we worked on several projects. This partnership has been going on for 3 years now, and we worked on several projects. And I wanted to have the audience, both here on campus or remote, see some of the projects that the students developed. So let's start with the first one. We can play the video, and Brandon, I'm just going to look at you guys because those are yes, we developed it, but then from healthcare perspective, I think it's going to be better if you guys talk about what was the purpose of those trainings. So the medical training simulation for nursing. What about that?
Yeah, so this is a trainer that we did for proof of concept, and you can see the haptic gloves that are here in the video. And we wanted to look at, could we take these haptic gloves and feel what skin feels like in a virtual environment and feel the veins and be able to grab the IV catheter and insert it actually into a patient's arm. And you can see here that we've modeled that and tested it out here at Full Sail.
Did we have any user experience run on this project? I wanted to see if did we really have that haptic feedback received?
Well, in most projects, yeah, we have an opportunity to improve the technology and offer feedback, maybe do a study. In this particular case, this was a prototype.
A prototype,
yeah. It's pretty effective, though. And it's,
yeah. I know it was. I saw it. It was impressive. Yeah.
Well, we were stretching the technology as much as we could. So, what are the limits? And that's really what we need to find out.
Okay.
So, can we deliver a training solution within the limitations of the technology?
Amazing. So the second project is the portable X-ray systems, and we can have a video start playing, and maybe Brandon, can you talk about this?
Yeah. This project was out of a need of a certain type of equipment that one of our campuses had, but the other one did not have, and that's a portable X-ray machine. So this trainer allowed both campuses to learn how to maneuver the device within a clinical space, basically a patient room, and then take an X-ray. The interesting thing about this project is we used LiDAR technology to scan the actual device that the one campus had. So what you see in the virtual is a one-to-one of the actual X-ray machine that is used in the hospital.
Amazing. I love it. Okay, so the third project is the physician assistant trainer, Sarah Field.
Yeah, the PA trainer came out of a need for looking at skills in the operating room in identifying breaks in aseptic techniques. So that's contaminating themselves. So you can see here in the video where anytime you see a little bit of red pop up, that's a break-in technique. And this video tool is great because it measures how many breaks in technique were within a given procedure or within a given exercise. Normally an evaluator would be looking all over the room and might not catch a break in technique, but that's really important that we're able to capture that. So it's a great tool. You can see a lot of red in there, so a lot of break in technique going on there.
Yeah, so everything that is red in there is like, I saw you earlier, you're like touching your hair and so on. That's like you're breaking like the sterile zone.
Absolutely.
You're going to have to send them back to like...
Actually, I'm in here without any gown or gloves on anyway, so I'm not clean in any way, shape, or form. So
perfect.
Yeah, that actual project was using part of the 3D cameras that Rob alluded to earlier that can scan the whole room in real time and grab more than just the video data. And actually, all that was recorded, so the students could then debrief and kind of see where they did break technique.
Amazing. So the next project is the Da Vinci surgical robot. And I don't know if we have a picture of, I wanted to show, yeah, here you go. So this is the DaVinci 3 surgical robot?
Yeah, this is the DaVinci Xi robot.
This is the Xi. Okay.
Yeah.
And then let's play the video of the training system, so that if you can explain what this robot does,
Sure,
how is it used, and then what was the training about?
So the DaVinci surgical robot is a minimally invasive surgical robot used for minimally invasive surgery. And it has access to the body through surgical ports that are placed in the patient's abdomen or chest or wherever their anatomical target is for the surgical procedure. The surgeon will sit in a surgeon's console and actually operate the robotic arms remotely away from the sterile field. And what this exercise is teaching the surgeon or the operating room personnel how to dock that robot physically to the patient. In order to do that now, we are doing that with a $1.5 million plus robot, and you have to have access to that piece of equipment. So not every hospital in the country, including ours, has access to a training robot. So by doing this in VR, we can suspend disbelief, and we can have them actually do the docking here and evaluate their performance at the same time. And this is a current project. We haven't been doing this, but what, 2 months, if that?
Yeah, not even probably.
Yeah. So it's going to really be a game changer for us and how we scale this throughout our organization for training.
You know, Todd and Brandon, like I want to say that, like, I'm really impressed. I don't know if many healthcare universities, I would say, that or programs that will use this type of technology to train their students. And I may be wrong. I may be maybe it exists out there, but I think this is pretty innovative from AdventHealth University to just how to say it, really put the time and effort to develop trainings like this. So you're innovating, and your students, as they're coming to your university, they're really getting to play with this type of technology. So what did you hear from your students? Is it kind of a point where it's differentiating you from other institutions? And then how is the training going? Are they enjoying that? Are they really not used to that teaching approach, and they're kind of rejecting that approach? I'm just curious, how is that?
I wouldn't say they're rejecting it. I think it's new. So when you get into a virtual environment, the first thing you start doing is looking around wow, this is really cool. I'm actually here.
Yeah.
And then it's well, remember what we're here for. We're here to train.
Yeah, you need to really focus. Go
right.
back.
Focus. Let's do what we're supposed to be doing here.
Yeah.
So so that's always the first challenge. So you really want to orient them to the technology first.
Yeah.
So when they get in there, they're not surprised or overwhelmed, and they can focus on the training at hand. And I want to point out, we're not just delivering it to our learners within the school. We're delivering it to our practitioners, our physicians and nurses across the system.
Amazing. I didn't know that.
And that takes time to scale as well.
Okay.
So, it's developing that content and working with our instructional designers to develop content and get that out as well.
I love that.
And this is why collaborations and relationships we have with Full Sail is very important.
Thank you. So how do you see emerging technologies and all these types of technologies change how healthcare is handled in the future? Let's start with trainings, for example. How do you see that?
Well, just scaling the training and finding cost-effective ways to push it out to a big audiences, and develop things that are much more engaging. We always refer to death by PowerPoint. That nobody wants to sit through a PowerPoint presentation anymore. Not in today's world.
I agree.
I can't stand that personally. So to deliver this type of training, leveraging this technology, and engaging our learners, because we have digital learners now. Some of our older faculty members, that's kind of a challenge, but we have digital natives that we're training, so they want to learn that way. So this is the best way to do it. Brandon, do you have anything to add?
Nope, I agree 100%. Yeah, I think that we're going to see this as a standard for training in healthcare, just based on the fact that we can scale this type of technology. It puts people onto equipment that they can't readily be hands-on with. So I think I mean, I'm all in. I've been all in for a long time in this technology for training, especially in healthcare. And I'm excited to see it get traction.
So when we're talking emerging technologies, we're not only talking virtual reality, augmented reality, visualization, and simulation. We're talking, especially in the future, we're talking artificial intelligence, we're talking machine learning, we're talking data science, we're talking user experience, 3D printing. How do you see all these technologies, different technologies, influence the healthcare industry and evolve the healthcare industry? And please, anyone, like...
Well, if you think about it, there's probably at least someone here who's got an Apple Watch. There might even be a diabetic here who's got a glucose monitor. Those types of technologies are going to increase in the health field to the point where you're going to be able to diagnose things based on what those pieces of equipment are reading about your health. Take that, dump that back to a doctor that's now doing a virtual doctor visit, and that doctor may not be the doctor that you think he is. It may be an AI that is now evaluating your health based on all the information they're getting back from that technology. And that takes everything full circle. And that's not too far away in the future.
I know, I was going to say, I'm like, I don't see that with the very far away. Yeah.
Yeah, I'm excited about using VR to augment what we currently do and lowering patient anxiety, lowering just improving the process. So, you look at the number of healthcare workers we need in the future and the amount of space we have, and if you want to increase the throughput of the system, you've got to push your training, your interactions somewhere else as well. And VR is XR. Any of these technologies is a really good opportunity for us to leverage those and make them work within the frameworks we already have. Maybe trim some seat time, and meet the needs of the future.
Amazing. How is data science used?
Absolutely, and then just access to care, peer access to care. I mean, not everybody can make it to the physician. Not everybody can get an appointment. But now, telehealth is completely
And also,
changed.
Patients are really, as Sean said, they don't feel very comfortable going to hospitals. And there's that anxiety of waiting and so on.
Particularly during the pandemic. Nobody wanted to come to the hospital.
Exactly. Nobody wants to go. Yeah.
So now I can, just see my provider on my telephone. And, that technology's here. And then being able to leverage all of the different technologies, your watch. Going to see your cardiologist and pulling your ECG right off your watch and just showing it to him on your watch, and then it's just like a visit there. Mm-hmm. I didn't even have to leave my house. So it's something that is here to stay, and it's going to evolve, and hopefully it will drive healthcare costs down because healthcare costs are skyrocketing.
Otherwise, yeah. Brandon, anything to add?
No, I'm good.
Okay, good. So let's talk about exciting things. I mean, all these things are exciting. In 2020, yes, it was a hard time for everyone. We were in the middle of the pandemic, but Full Sail University and AHU partnered to win the ITSEC, and I'm going to try, the Inter-Service Industry Training, Simulation, and Education Conference's annual Iron Dev competition. So that was the highlight of the year. I remember that year when I heard about the award, I was like, thank God, finally, good news coming out of this. Tell me about the project, but before that, let's maybe play first the video, see Dan talk about the projects, and then you guys can tell me.
We're going to show you is this would be a potential world map that might show the spread of the data. Right now we're looking at the globe from a God's eye view, but I'm going to zoom in on Florida because that's what we're interested in. Since day one of this pandemic, we've been tracking the data. This data is from Johns Hopkins University. And you'll notice up to 60 days in, there's not a lot of growth, but now look at a peak at South Florida. It's starting to come in at South Florida, and as we get past day 150, it starts to grow in the Orlando, Tampa, and Jacksonville regions, and even out there in Pensacola on the wing of Florida has started growing. And as we approach today, we are still now seeing this is more the cumulative growth, but mostly the metropolitan areas have been hit. So let's talk about Orlando, which is what the hospitals you gentlemen represent, from anywhere from Apopka to Celebration. Each one of these hospitals, could you select your hospitals, gentlemen, which you represent? So what we wanted to talk about today, as you can see on your menus, we could be dealing with transferring anything from medication to moving patients to actually even possibly moving your personnel teams. But we're going to look at the ICU beds. So if I wanted to transfer beds here, I could take and move some of my beds.
Awesome. So first of all, I'd like to say I'm glad we got Dan Mapes on the program, whether a voiceover or not. But this project came about. There's some criteria that IronDev and the folks at IDSIC had given us, and I'll let Sean talk about that. But basically, our goal was to kind of virtualize a command center. So if you think about hospital executives in a pandemic where they may or may not be able to get to the office, but they needed to make some critical decisions. So if we brought that into the VR environment, then they could be anywhere and meet together and take care of that critical need to get the hospitals ready for anything that may happen in a pandemic. So that was our idea, and it fit within the parameters of the program, and then we submitted that and won Most Innovative Award, I believe. So.
Yeah, the most innovative.
Yeah, and this particular project involved a lot of students at a very tough time. COVID-19 is raging, and we also were coming up on Thanksgiving break, and so you have about a month to get everything together, and we're competing against corporate teams.
That's what I thought too, right?
Fortune 500 companies, and they have full-time employees, years in the business, and we have Dan Mapes. We've got experts at AHU, we've got our students, and very awesome that we could win that award and produce something that actually sparked a lot of interest as well.
That's amazing. And actually, Rob, you want me to say it? You want to say it?
So keep your ears peeled. Within a month, there's going to be an announcement, and I believe there are 2 more awards that are going to be delivered.
Yes, so part of this partnership now, we heard that we have 2 more awards. So congratulations to everyone, and stay tuned to know which award, what conference, and so on. Okay, so let's talk about projects on the horizon. Anything is being developed, implemented, brainstormed right now?
I'm super excited to get some of our students side by side with Full Sail students, and that's in the works for sometime next year. We have an occupational therapy program, and they do a whole semester on adaptive equipment and adaptive technologies for people who may need some extra help in their daily life tasks. So SimInvis does a great program called Positive Cause, and so I think these 2 things are going to align great to create some 3D printed things, some electronics and robotic opportunities, and really give back to the community. So I'm excited about that coming up.
I'm happy you mentioned Positive Cause. So Rob, can you talk about the Positive Cause, please, in the SimVis program?
So 2/3 through the program, our students have an incredible skill set, and they also have access to an incredible lab of equipment. And so we've asked them to take that skill and the equipment and to create something that's going to help those that struggle with life's daily tasks. And so we give them a group or an individual, and they use the technology and their skills to develop some type of assistive technology to help them. We have helped quadriplegics in the past. We have helped paraplegics. And our most notable experience was with SECO, which is a cerebral palsy school. and we created an interactive ladder for them. It is technology, they say, that has changed the way they use the ladders that are critical to their environment. And they say it's that technology hasn't changed in 70 years, and this interactive ladder made that giant leap. We gave that to them, including all the IP rights. They found a lawyer to do some pro bono work, and now that particular project is patent pending.
That's amazing. Anything you want to add, John?
Yeah, I mean, the power of bringing these two organizations together and having industry experts, healthcare professionals working with people who can make things is kind of what that room is about. Having that large format printer, being able to directly impact the lives of individuals, not large organizations, not mythical people. So that is, I think, going to be the most exciting, I guess in the immediate future, in the couple months, program that we start up. So I'm excited to see the impact that has locally.
Amazing. So what kind of background would someone need to have if they want to develop projects like this or use the technology that we have in the healthcare technology lab?
Well, Full Sail has a very unique program on campus that actually addresses all of those skill sets. And it's a unique program because in my research in developing that program, there's not a school out there that has all these same combinations of technologies that go together. So 4 focus areas for SimViz: code, fabrication, visualization, and then pulling all 3 of those together into production. And like I said, you'd be hard-pressed to find another university out there that adds all those components together. And the SimViz program has that. So in order for us to be able to take things to the next level, our students have to be able to program. In order to be able to fabricate things, our students have to know how to design and use the digital fabrication equipment. And then to be able to add the visualization component, they need that VR education on not only how to use the equipment, but how to develop for the equipment. And then being able to take all those 3 areas and combine them into a production environment to produce something that is either a prototype or a proof of concept is quite unique to this university.
Amazing. So, talking about the students, how is this open only for emerging tech students? Which programs under emerging tech, or is it open for everyone at Full Sail?
So all the projects that we do in this environment, every one of them has some component that we have to reach out to another degree program to assist.
Yeah.
Whether it's we need art from digital arts and design, or we need art from computer animation, or we need sound from the audio world. The interactive ladder had games in it, so there's game design in there. So it's all dependent on the individual project, but when we need an additional component, we reach out to that program and see if we can find somebody that's willing to assist.
Sean?
Yeah, and we need producers for these projects as well, people that keep everything organized and everybody moving forward, make sure the needs are met for the programmers. And the Game Design Masters program provides an opportunity for those students to join the healthcare lab with Dan Mapes or Pat or whomever else to help organize those projects. And then the user experience lab, there are certain projects that require some type of data analysis or research or feedback, and that's another opportunity for students to be involved, and that's through the Game Design Masters program.
Perfect. I mean, I'm way over the time. I was supposed to leave 15 minutes for our Q&A. So you guys, if you have any questions, we have the microphones. Just feel free to go. Tell me which program you're from and ask your questions to our guests. And if we have any questions from the online remote audience, please either display them or come to the phone. Go ahead.
Hi, my name is Nick Verico. I'm in cybersecurity. So I have two prior associates, and I was a medic in the Army. So I've touched 7 or 8 different industries in various ways. More recently, I helped write a proposal for a mission daybreak through the VA. I don't know if you guys in the healthcare are familiar with that. So the VA gave away $22 million to reduce veteran suicide. And so the proposal was a simplification. They brought me on at the last minute and they said, hey, what do you think? And I said, hey, I think I can reduce this down to something very simple. And so the concept, they had a stress reduction app, right? So it's just an app, no other technology really paired with it for the general stress reduction protocol, but they had a smartwatch. So they would use a Garmin and they had a couple of other devices, still early tech stages. But I was able to reduce it down and communicate very clearly, and so they won the $100,000 Promise Award for that. My question here is how is the communication done for some of these technologies, so like VR, AR, these advanced training type tools that, you know, what is the best way to communicate to somebody who's not technical, who has no idea about these things? Like, hey, this is really cool, and you should care about this because it's tech, but they're like, I don't get it. So, you know, is there messaging or is there a communication profile or strategies around that kind of stuff to bridge that gap? And when you talk to a patient, right, being a medic, it's like, hey, we have this thing that can help you. How, right? You have to be able to tell them how and then get over that kind of anxiety gap in the communication strategy?
That's an excellent question, Nick.
Yeah, so I can answer that from a facilitating side of training within our hospitals. So it's what we kind of train the trainer is what we did. So we have, I'm a department of one where I work, and so we had to train the educators that are in the units to kind of be the facilitator of the VR equipment. There's a lot of apprehension, so basically, we made sure that the facilitators were comfortable in the virtual environment first, and then they kind of got it, right? So then they could pass that on to any of the learners as they progress the education that needed to be done within the unit. So it's just kind of, I guess it's organic in a way, that communication in the training aspects of it. We're not doing anything at AdventHealth currently patient-wise with VR or any of these emerging technologies, but that will be a gap when we get to that point. And I think easing it into the room, maybe it's the headset is just there and they put it on and they see a nice video, or they get transported to a different environment just to kind of forget for 5 minutes that they're in the hospital. And then, you know, kind of ease the patient side into it, I think is probably the best way to do that.
Well, VR technology is very consumer facing now, but in healthcare it's pretty new, particularly in delivering training.
Yeah.
So we're exposing our learners and our faculty to this stuff and our practitioners, even, you know, out onto our nursing units currently. As everybody gets more exposed to it within healthcare, they'll see the possibilities. When we have an intake process and we start looking at what content can be developed in VR, not everything is, VR might not be the proper modality. You know, sometimes there's a better modality than just using VR. It has a very high cool factor, but it might not be the right training modality that we need to use. So we really look at that hard and heavy, but I think it's just exposure. As more and more of our learners and faculty and staff get exposed to the technology, that will generate more ideas and get the word out there. And then you'll see creative things that'll start to be developed. And hopefully this relationship will help bridge that gap.
Yeah, so I'll echo what Brandon said and Todd as well. First off, yeah, you got to build trust, and you've got to get someone to try something new, especially when they're going through something quite difficult, maybe some difficult thoughts or anxiety, but probably not going to jump right into some type of high-tech solution. But if you can establish that relationship, and that's part of some things we'll investigate in the future, build something that reaches them, connects with them on a less invasive level, then you can get them to the next step of doing something more, I guess, kind of VR, XR, something more out of the ordinary for them. But yeah, certainly those technologies might not always be the best fit right away, but after establishing that relationship, I can see a lot of potential with those tech.
Time. It's going to take time. There are already some very good PTSD VR environments out there.
I was going to say that.
But it's going to take time for the general public to, one, be able to afford it, and two, for mobile headsets that don't require a big, fast PC. So the cost has got to come down, but more importantly, there's got to be buy-in. And I'm going to go to technology that every one of you has in your pocket right now, the cell phone. You've got buy-in. Everybody's got a cell phone now, and except for those few that are still stuck on flip phones. But I say flip phones, but that's what started it all. And so it's just gonna take time, because the technology is going to get better. The technology is going to get less cumbersome. And mark my words, at some point in time, you're going to be wearing contacts that do a lot of this stuff. Definitely glasses. And at that point in time, everybody's going to have one. But again, it's just going to take time.
Thank you. So I have a question from the audience online. Will AdventHealth be partnering with the cybersecurity and IT students in the future, specifically in regards to securing these systems or HIPAA information?
Absolutely. I didn't even realize Full Sail had a cybersecurity and IT.
What?
Yeah. So that's amazing. Yeah,
we do. Yes.
So yeah, HIPAA is a big deal. If you noticed throughout our presentation, a lot of the stuff that we focus on was not patient-centric for that reason. It's more training of employees and students who become employees. But again, as we get to the patient-facing side of things, that is definitely systems that will have to be analyzed and made sure that any data that comes out of the headset, that the patient is seeing is scrubbed so that we're not breaking that patient confidentiality.
Yeah.
And
cybersecurity is a big deal in everything we deal with, especially once we have the patient records.
It's a huge deal for us. Yeah. Particularly when we're delivering a lot of this content on a wireless headset across our network. Mm-hmm. So we have to go through all that information security approvals just to get the device qualified on our network.
Yeah.
So yes, we're interested.
Yeah. That's under emerging technologies, by the way, guys.
And another reason why this partnership is so beneficial, it's you ask and you receive. You guys have so many different departments of people who are, industry leaders. So that's a great way to better this partnership, is
amazing.
Getting to the point where we're securing our proof of concepts to go out.
Yep.
That's a great step in the production process once we get past that. So.
I love that. Next question is, what technology-based knowledge is in the highest demand by the industry right now? What technology-based knowledge is in the highest demand in the industry right now?
Assuming they're talking the health industry.
Yeah, I'm thinking also, is this in the health industry or is it in general? Well, we can answer it from both sides anyway, I guess.
Yeah, in healthcare, it's training, and so instructional design, all the way through coding, for Unity, or web, the whole gamut.
Cybersecurity, internet security.
Yeah, technology has really infiltrated the healthcare system. And in the 8+ years that I've been here, I've seen amazing changes from pen and paper and basic employee and patient record taking to full-blown implementation of large healthcare technology migrations for patient data. So it's run the gamut.
Yeah, electronic medical record being a big deal for our organization. We've been scaling a new solution for the last year across our entire enterprise. So, digital technology is here to stay. It's only going to expand, and we're going to have a need in all of the IT disciplines within healthcare.
I think from emerging tech perspective, it's the visualization, AR, VR, XR, AI, artificial intelligence is important. I mean, all of it.
I think from a fundamental level, it's understanding programming logic and programming.
Yes. Yeah, I agree. And then advanced will be the VR, XR, artificial intelligence, mobile development, as you said, IT and cyber, production, depending on what kind of project. So I think all of them are important. We're going to take one question. Yeah, go ahead.
Sure. So my name is Dylan. I'm a lab specialist for game design. This is going to be sort of an open-ended question. I was curious about sort of the QA process on some of these projects, because surely if you're making interactive media for like quadriplegics or people who are paraplegic, like people with these sort of severe disabilities, I was just curious what that process was like, because if you're making something like a video game, you can have almost anybody test it, and you're going to get useful information out of it. But if you're making a simulation for somebody with a certain disability or a certain thing like that, you surely have to find people with those disabilities to test it. And what are some of the difficulties that maybe you guys have come across regarding QA on those projects?
Excellent question, Dylan. Yeah.
So when we assign a project to a student or a group of students, we already have that person in mind. So when we went to SECO, we knew who our client was. And we built a prototype and sent it to them and had them beat it up and then send it back to us and give us their response. When we're working with a quadriplegic, you give them a device and you let them play with it for a week and then bring it back and tell us what was good and what was bad. So for us, it's not we're going to make a device for a quadriplegic somewhere. It's we're going to make a device for this particular person. And as a result, that back and forth is immediate, as opposed to having to find several people to give the product to and have them. We're dealing from Positive Cause. We're dealing with a specific individual or a group of individuals.
Thank you. Next question. How will AdventHealth University and Full Sail University students work together in this space? Are there defined responsibilities?
I think this is play it by ear.
Yeah, we can answer the first question. They will be working together in the space in some capacity in the future. Nobody likes defined responsibilities, so we'll just leave it there.
Yeah, right now, I mean, we're providing a lot of the subject matter expertise, whereas Full Sail is providing the technical expertise. So we're kind of bringing the ideas and the projects, and we're working collaboratively to produce it.
Yeah, 100%. The space is a place to bring people together, and if you share a common environment, great things are going to happen. And we need that expertise that AHU offers.
Yeah, I agree. I mean, every time I'm on campus here, inspiration happens. And I think the more people that we bring from AdventHealth and AdventHealth University to this space, to this campus, you're going to see inspiration. And I think that will slowly define what we do within that space.
Perfect. I'm going to take the last question because we're already over the time, and I want to be respectful of everyone's time. So last question is, are students able to take a tour of the new lab to learn about the new technology in the space? If yes, how? Yes, they are able to take a tour of the new lab to learn about the new technology. We have daily tours. You can work with our tours team and request to go see it. We can always reach out to our instructors. The labs is in 4A, and reach out to just request either an appointment or something and go and have someone explain the technology to you and what we're doing there. Anything else you want to add, Rob, about that?
It's all going to depend on what's happening in the lab.
And the lab, that's a very good point. Yeah, that's a very good point. Well, thank you guys for today. This has been really amazing. Like, I learned a lot from this partnership, the different projects that have been implemented and are being implemented in the future. And I'm looking forward to seeing all the amazing projects that are going to come out of this partnership and how we're going to be impacting healthcare, the healthcare industry, and maybe now how cybersecurity is going to be added to this new partnership and how we can also help you guys on securing the patient's records. Thank you, Sean. Thank you, Rob. Thank you, Todd. Thank you, Brandon. Thank you, everyone here at the Fortress. And thank you, everyone who watched remote through YouTube, LinkedIn, and Facebook. This is Dr. Haifa Maamar from Full Sail University. Have an amazing day.